My dear friends, I am going to discuss about how to diagnose hypertrophic obstructive cardiomyopathy, or what are the various diagnostic process by which we can diagnose hypertrophic cardiomyopathy. Now, hypertrophic cardiomyopathy is a type of cardiomyopathy where there is asymmetrical hypertrophy of the heart muscle, especially interventricular septum facing the left ventricle, and which compromise the left ventricular outflow tract, leading to various signs symptoms of the disease. And over time it ultimately affects the pumping action of the heart, and it may leads to heart failure, various cardiac arrhythmia, and even responsible for sudden cardiac death. So today we'll try to understand what are the diagnostic method by which we can diagnose the disease. So number one is that family history. Now those persons or those individuals who gave a family history, who have already died of hypertrophic obstructive cardiomyopathy, or who are suffering from hypertrophic obstructive cardiomyopathy, may be one of the important way by which we can diagnose a patient. So those patients who who can give or who gave a past history of suffering from any HOCM by any family history, or any family member suffering from obstructive cardiomyopathy at present, or who had already died before because of HOCM or because of any sudden cardiac death, for those patients we can go for screening to rule out presence of HOCM. The test may be echocardiography or genetic testing and so on. So those patients who give family history of HOCM, we can indirectly helps in diagnosing in the present. So history and clinical features are very much important. Various sign symptoms like shortness of breath, then faintness, syncopal attacks, then lightheadedness, then chest pain, then angina like chest pain, then sudden syncopal events. So all those things ultimately, or arrhythmic situations or atrial fibrillation, can ultimately we can correlate and helps in diagnosis based on the family history also. So both the family history and some symptoms of the disease or clinical features of the disease can help in early diagnosis of the disease. But most of the patients in early stage of the disease can be asymptomatic. For them we have some other testing modality like genetic testing. So what is genetic testing? In genetic testing we are going to see any genetic mutation in various genes like cardiac binding protein C, or other genes like beta myosin heavy chain, or AC angiotensin converting enzyme E, or troponin T, troponin C gene mutation we can look for. And because these are the various genes which may leads to HOCM or hypertrophic obstructive cardiomyopathy. So genetic testing also plays an important role in diagnosis or early diagnosis of HOCM in patients who are giving sign symptoms, or even in asymptomatic patients, or those patients who are not showing any sign symptoms of the disease. So genetic testing can help in early diagnosis of the disease and helps in progression of the disease or preventive measures to so as to prevent the disease. So, genetic testing can also test or diagnose in those subjects who are asymptomatic because of absence of any clinical feature or sign symptoms of the disease in various patients also. Besides, we can go for echocardiography. Echocardiography can be very much important diagnostic tool because it can show the septal thickening or asymmetrical septal hypertrophy or left ventricular outflow tract obstruction in studying the hemodynamics of the heart. Echocardiography can focus about the thickness of the heart muscle, the ejection fraction, various chamber defect, whether there is any septal hypertrophy or not, whether there is any heart failure or not, whether there is a ejection fraction is decreasing or not, or whether there is a stiffness of the ventricle or not. So all those things can ultimately help in diagnosis of the HOCM, hypertrophic obstructive cardiomyopathy, as well as in finding out the severity of the disease also. So echocardiography can be one of the important diagnostic tool for diagnosis of hypertrophic obstructive cardiomyopathy. Besides, ECG can be important in ruling out the arrhythmia changes. because in ECG we can find out any arrhythmia, which may be one of the important complication of hypertrophic obstructive cardiomyopathy. Now, hypertrophic obstructive cardiomyopathy may leads to cardiac arrhythmic situation like atrial fibrillation, which increase the risk of death due to thromboembolic events or thromboembolism. Now, ECG changes may be very much important as it helps in checking out the or ruling out any electrical abnormality or cardiac arrhythmia that may be because of hypertrophic obstructive cardiomyopathy. Besides, cardiac MRI is one of the important diagnoses because cardiac MRI can find out the asymmetrical thickening of the heart wall. It can find out the left ventricular outflow tract. At the same time, it can also find out the thickening of the ventricular septum. So all those things can be important diagnostic feature for diagnosis of hypertrophic obstructive cardiomyopathy. Besides, stress test can be important, or Holter monitoring can be done in case the patient is suffering from any arrhythmic situation or cardiac arrhythmia or atrial fibrillation or any ectopics production. All those things can be diagnosed if the patient can go for Holter monitoring or stress testing. So when it comes to diagnose, the most we can start from family history, because family history also plays in role in diagnosis of the disease. Those patients who gave a family history, positive history of sudden cardiac death, any siblings or any relative suffering from hocm, or who have already died suffering from hocm, for them we can easily go for diagnosis of hocm. Besides, clinical features, sign symptoms can also help in diagnosis of or pre-diagnosis of hocm. Echocardiography is one of the important tests because it can find out the, or it can rule out the, or it can diagnose the presence of septal hypertrophy or septal thickening, which is one of the important pathophysiological finding of hypertrophic obstructive cardiomyopathy. Besides, genetic testing is also very much important because genetic testing can show the presence of genetic mutation in those subjects who are asymptomatic till now or can become symptomatic in future. So for them also, genetic testing can find out the gene responsible like beta myosin heavy chain or cardiac binding protein C or angiotensin converting enzyme mutation or troponin T or troponin C mutation. All these gene mutation can lead to increased risk of HOCM or even sudden cardiac death. So genetic mutation can diagnose in asymptomatic patients also, or HOCM patients without any prior clinical features or sign symptoms of the various diseases. Besides, cardiac MRI is very much important. 60 to 70% of the cases, in 60 to 70% of the cases, cardiac MRI can ultimately isolate the or diagnose the thickening of the ventricular septum and ultimately diagnose the hypertrophic obstructive cardiomyopathy. Besides, we can go for ECG to see any abnormal heart rhythm, which may be one of the important complication of HOCM. Long-term HOCM may lead to cardiac arrhythmia like atrial fibrillation, which increase the risk of thromboembolic events. So these are the various important diagnostic tool by which we can go for diagnosis of HOCM. Thank you very much.